Hello, lovely.
Hello.
How are you?
I'm good, thank you. How are you?
I'm good, thanks. Nice to meet you.
And you?
I'm Dr. Nicola. What seems to be the problem?
So I've been having some neck trouble, a bit of stiffness and a bit in my shoulder, so I just wanted to come and have it checked out.
Okay. So, neck stiffness. And... okay. Have you been having any pain?
A little bit, yeah. Just kind of stiff. Hurts when I move it too far.
Is one side worse than the other?
Yeah, it's this side that's playing up.
Okay, so your left.
Yeah.
And how long have you been experiencing this for?
About a week.
Okay. Do you recall doing anything in particular, or is it just you woke up one day?
I just woke up, yeah.
Okay. And have you had anything like this before?
When I was younger.
Okay, thank you very much. So, actually, I'm going to assess your posture first.
Okay.
So, if you just sit as you would normally. When you're sitting like that, do you have any pain anywhere else?
A bit mid-back.
Okay, now would you like to sit up nice and tall for me? Wonderful. And any pain anywhere at the moment?
No.
Okay. So when you're sat up nice and tall, this bit here isn't so arched, okay? And because you've got no pain that way, it's better to sit like that. However, it's not always the way we want to sit. So overall your posture is okay, but it could be improved, and that could be hindering this section a little bit as well.
Yeah.
All right, but you can sit however you're comfortable now. Okay. Okay, if you wouldn't mind just facing me so I can check your shoulders. Okay, just face that wall for me.
Turn.
Yeah, please, thank you. And just sit normally. Okay. Okay. Maybe a little bit lower on this side. Okay. But overall, your shoulder alignment is actually pretty straight. Okay, now sit up nice and tall for me. Okay. Yeah, I can see the sort of tension when you kind of change position. If you just slouch again as you would, okay, and back up. Yeah, so I can see a little bit of kind of tension here. All right, you can relax. Can you turn back to me, please? Thank you very much. Tension, build up. Okay. Alignment. Pretty good. And I'm thinking as well, here is probably a little bit wider, as in probably your muscle is a little bit inflamed. Alright, whereas that side isn't so much, which obviously could be contributing to the pain and restriction.
Yeah.
Okay.
I do like lift as well, to be honest.
Okay, so how often do you go to the gym, my love?
2 to 3 times a week.
Okay, and what kind of things do you do?
A weight lift or run.
Okay.
Do a bit of Pilates and yoga some days.
Okay, so the weightlifting could be contributing obviously to stronger muscles. Which side do you write with?
This one.
Okay, so even though this has got your most dominant hand, this side is definitely a bit more larger. Not in a bad way. Alright. But I feel like that's more to do with inflammation rather than what you've worked out at the gym, if I'm really honest with you, okay. The running wouldn't have really contributed to that. Pilates maybe, depending on what kind of moves you are doing.
Okay,
right. But you are using your muscles, and that's the good thing.
Yeah.
So, okay. Lovely. Okay, you can relax. Have you been experiencing any headaches?
A bit, yes.
Okay. Anywhere in particular?
Mostly front.
Okay, it's a bit of tension going on there as well. Could be from your neck. We tend to get headaches. It kind of sort of links up, okay? Any numbness, tingling anywhere?
No.
Okay. Any grip issue? Are you struggling to pick
No.
things up or anything like that? Okay. Okay, that's good. Right. Before I start having a feel around, I want you to do a couple of things for me, if that's okay. So, if you carefully pop your head right down to your chest. Okay, and when you are like that, have you got any pain or discomfort?
No.
And if you wouldn't mind just me turning you. Okay, stay there. And back up to normal. Okay, now can you pop your head as far back as you can, but slowly? Okay, wonderful. Any pain or anything?
No.
Okay, and back to normal. Wonderful. And if you could face me. Now, if you could carefully turn your head that way. Okay, any pain, tightness, restriction anywhere?
No.
Not too bad. All right, and back to me. Can you do the same that side?
That's where it hurts.
Okay, and could you just point to me where the pain is?
Just here.
Okay, wonderful. You can
A
relax.
bit here.
Okay, so okay. Now, when you were doing that, did it feel quite tight? Just on that side?
Yeah.
Okay, so tight. Okay, if you can raise above. Any pain anywhere?
A bit here.
Okay, and back down. If you face forward and pop your arms out to the side for me. Outwards, that's it. Any pain or discomfort?
No.
Okay, and relax. Good. If you can just face that way, and can you pop your arms in front? Any pain or discomfort anywhere?
A bit in the middle of my back.
Okay, relax. Okay, just look at me. Okay, now would you mind just shrugging and hold it up? So this side is definitely lower, my lovely. Okay, relax. Okay, and just do it multiple times. And again. Relax. Okay, can you roll them forward? And backwards. definitely something going on here, and I can hear a slight little bit of crunching, cracking going on there.
Especially when I'm like that.
Definitely. Was there any pain doing that?
No, just aching a bit.
Okay, so there's possibly some air trapped in your muscles as well, which obviously could contribute to the inflammation and pain and restriction. Okay. Okay, lovely. Okay, now would you carefully rotate your head in a circle? That's it. And carefully the other way. Okay, relax. Any pain, tightness, restriction, anything?
Just a bit of cracking in the back.
Okay.
Through here.
Yeah, I could hear a slight little bit of noise. Okay. Now, are you on your phone a lot? Are you on the computer? Is your work kind of down a little bit? Okay. So if we're doing like repetitive movements as well, we could get repetitive strain injury and what we call tech neck from when you're down a lot. That can cause a bit of a hump there, and obviously tightness, pain and things like that. Okay. Could possibly be contributing to your issues. Okay. I'm going to check your strength in a moment. Okay. Right. So I am going to pop on some gloves. Hold my hands. Can you squeeze them harder, as hard as you can? Good. And this one. Same time. And again. Definitely weaker that side, but it's not your most dominant hand, so it is expected. Okay. Push. And I'm going to push you back. Try to push me. Okay, relax. Wonderful. And I'll put my hands there. Okay, shrug. Again. Okay, now do it again. I'm going to push down. Okay, try and lift me off. Okay, wonderful. Okay. Just relax. Okay, I'm going to just check your reflex. You did get a little bit of a tingle there down your arm. Okay, on the side. Okay, turn your palms over. Relax that down. And that one. Okay. Right, what I'm going to do now is assess your upper body.
Okay.
All right, so I'm going to start with your arms. So if you just face that way for me, I'm going to start assessing here. Now, while I'm doing this, please let me know if there's any pain, tightness, weird sensations, okay?
Okay. There's a bit of sensitivity in that finger.
I could hear there was a little bit clunky. Okay, just relax. Definitely a bit of tightness here.
Mm-hmm. A bit tender there.
Mm-hmm. Okay, turn your hand. Okay, relax.
All a bit tender there.
definitely some tightness here. Okay. Got a little bit of tightness here. Bend your head down. Definitely tightness here. Put your head back.
There's definitely a bit of relief when you were rubbing here.
Yeah. You do tend to hold a lot in our occipital. Okay, can you shrug up? Now relax. Any sensations or anything?
No. That's a bit tender.
Mm-hmm. I'm going to pop this tuning fork in places. I just need you to tell me how it feels, okay?
Okay. Like a vibrate. Same.
Okay, so now you know what that feels like. Just tell me if it feels different anywhere, and if you get any tingling, numbness, or anything like that, okay?
Okay, thank you.
Sometimes with light touch our skin can feel sore, so if you do notice any kind of soreness or weirdness, just let me know.
Okay.
Okay.
Bit of pain there.
Mm-hmm.
Pressure.
Open your mouth. Close. Open. Close. Just do that a few times. Okay, and chew. Okay, relax. So pain here. That's examination complete.
Oh, thank you.
All right. Now, I'm not overly concerned.
Oh, that's good.
All right. There's nothing serious going on. There is no signs of fibromyalgia or anything like that, or any chronic pain issue. Now, what you have here is not the best posture.
Okay.
Which isn't helping, but you've got what we call tech neck, repetitive strain injury in this kind of section, and I think that is down to your job.
Okay.
All right, and there's not a lot we can do about changing our job. It's about finding what's comfortable for you.
Okay.
All right. Now, it is essential that you go and have a sports massage. I think that'll be really good for you. Okay. And they need to work on your upper section. You've got a lot of tension, a lot of build-up that needs breaking down. Okay, and I think you'd be beneficial to have sports massage 2 to 4 weeks. Okay, so 1 every 2 or once a month, whichever you can afford. And then see what the specialist says. It may also be good going to a chiropractor. That may be helpful to you, some neck adjustments and help with the alignment and things like that. That is something. And maybe even acupuncture.
Okay.
All right, so you can pop some needles here and help. Obviously, these are all quite alternative like treatments, which I do like to recommend if possible.
Yeah.
Now, if you are in a lot of pain, you know, have things like hot water bottles here. Try a bit of cold. It doesn't work for everybody. That's why I tend to recommend more heat.
Yeah.
Now, you can get things like CBD Slav and things like that. It works wonderful. So you can just massage it in this area. It's easy to do yourself, and it's got the CBD benefits, and it just is incredible for this section. If you've got somebody that can massage it in for you, that'd be really good as well. Okay, and you know, these are things that you can carry on long term. Maybe look at getting certain butterfly pillows to help you sleep a little bit better, and try to get a better chair for working in, and try to refrain from looking down as much as possible. You know, this can be improved, but obviously overall technique, you're not really going to get rid of it necessarily. It's about controlling what you've got. Pain relief if you need it, anti-inflammatory if you need it, but try not to rely on that. Okay. And it's about building some strength. So with you doing your weight training, I think that's fantastic. So if you can try to work on this, but then you will need a massage to kind of break that down a little bit. All right, do you have any questions?
No, that's perfect. Thank you.
Okay, so I will write up everything and I'll get it emailed to you, all right, my lovely?
Yeah, thank you.
And I will also give you some recommendations of chiropractor, sports massage, and some equipment recommendations, pillows and things like that. And obviously places where you can get CBD legit and things like that, if that's all right.
Yeah, perfect. Thank you.
Okay. Lovely. And then when you receive this, give me 3 days or so. If you do have any questions about anything, please contact me.
Thank you very much.
It was wonderful to see you. And just take it easy, and you know, warm baths, bit of CBD salts and things like that as well.
Thank you.
All right, you're very welcome.
Bye.
You take care now.
And you.
Bye-bye.
Bye.